A very good evening, Eizoc members, not only from the Eizoc states, but from all over India. This is our ORPI program, particularly for the postgraduates and the students, as well as the young researchers, those who have research in mind. This will be a great benefit for all of us. We have with us one of the most prolific speakers from the South, Dr. Ramesh Venkatesh, and we are all eager to hear from him. And we have our panel from the Eizoc states and all our learned HODs from different states of the Eizoc. And I also welcome our discussants today to please listen to this, and this will be of immense benefit in your research purposes. With that, I hand over to Dr. Subudhi, who has been managing this program over the years together. Over to you, sir.
Thank you, Dr. Das. So, I'm sharing my screen. Can you see my screen?
Yes, sir.
Okay.
Screen is visible.
My voice is also coming?
Yes, sir. Excellent. Please go ahead.
Okay, thank you. So, on behalf of Eizoc, I welcome you all once again to our program, Ophthalmic Research and Publication Initiative Program, which we were holding since last few years. And our interest is to stimulate young researchers, mostly young fellows and also the residents, to come forward and write some journal articles for the journal. So today's topic is the reference management, and we have a very good speaker, Dr. Ramesh Venkatesh, who was here with us in January this year, 2025. Once again, December again, we are having with him. And this is our Eizoc team president, Dr. Jennifer, could not join due to some personal reasons. Dr. Secretary, Dr. Devashish Das, and Chairman Scientific Committee, Dr. Nitin Dhira. And mentor, Dr. Chaitra is our mentor, always see there with this Orpi program since the beginning. So I welcome her again to this program, and really I'm thankful to her selecting the topics and selecting the speakers. And I have with my two co-coordinators, Dr. Sabyasachi Patnaik and Dr. Santosh Mahapatra, always with me, guiding and helping in this program. And today's speaker, Dr. Ramesh Venkatesh, he will be introduced by our moderator, Dr. Ranjana Kumar. So she is an ophthalmologist, Brightside Eye Hospital partner, and she is always with Eizoc programs, both virtual and physical programs. I welcome Dr. Ranjana to this RP program. And today's panelists include Dr. Sucheta Parija, Professor, Head of the Department, AIMS, Bhubaneswar, and Dr. Sujata Priyambata, Professor, High Tech Medical College, Rourkela, Dr. Sachla Bhoi, Professor, Head of the Department, Bhimbhoi Medical College, Palangir, Dr. Sarmishta Behra, Professor, Bhimsar Burla. And from East, other states, Dr. Chandana Chakravarti, Professor of Ophthalmology, Bankura, Samilan Medical College, Bankura, West Bengal, Dr. Ruma Das, Professor, Head of the Department, Silchar Medical College, Assam, and Dr. Sunil Kumar, Professor, Head of the Department, RIMS, Ranchi, Jharkhand. And today's discussions, there are about 10 discussions. We have a variety of discussions from all the eastern states. Dr. Tejaswini Palla from AIMS, Bhubaneswar, Dr. Bhavani Shankar Sahu, High Tech Medical College, Rourkela, Dr. Sadap Seth, Balangir Medical College, Dr. Spriti Patel, Bhimsar Burla, and Dr. Prabhasha Panda, Bhimsar Burla, Dr. Somi Purohit, Tilochan Natrale, Dr. Saki Nautial from Dubai Hospital, Dr. Sasmita Mishra from Bhimsar Burla, and Dr. Asmita Sukhdev Dharmesi, Nalanda Medical College, Patna, and Dr. Saptarshi Mukherjee from Bankura Medical College. So our aim is to invite the head of the departments of different Eizoc states to encourage and to bring their residents for this program, because this is mostly meant for the residents. So I wish the residents will get immense benefit from these programs. Without not wasting much time, I hand over the podium to Dr. Ranjana Kumar to start the session after introducing the our speaker. Before that, few word from Dr. Chaitra Jaydev, our mentor. Dr. Chaitra? Dr. Chaitra, are you there? Okay. Dr. Ranjana, please proceed.
Yes, I'm here. I'm here.
Please, have few words.
Yes, so it's been a pleasure being part of the Orpi organizing team. And today's talk, I think, is particularly relevant. And I'm so glad that Ramesh will be covering it. Because after we start writing papers, we always get stuck at the references and we don't know how to do it. And it's an integral part of publishing. So I'm glad we're doing this topic today. Over to you, Dr. Ranjana.
Thank you, Dr. Chaitra. Good evening, everyone. It's a pleasure to be introducing Dr. Ramesh Venkatesh, our speaker for the evening. He's a senior consultant in Vitro-Retina at Narayan Nethralaya, Bangalore, with over 15 years of experience. He's a fellow from Shankar Nethralaya, Chennai, and an expert in managing diabetic retinopathy, retinal vascular occlusions, ARMD, and performing MIVS for retinal detachment and complex retinal pathologies. With more than 250 peer reviewed publications, his research focuses on macular telangiectasias, CRAO, CSCR, etc., and the role of retinal imaging in chorioretinal diseases, seamlessly integrating clinical care, research, and education. We are very proud to have you here, Dr. Venkatesh, and I'll request you to kindly proceed with your talk.
Thank you, Dr. Ranjana. I hope I'm audible.
Yes, you're audible.
And I hope my slides are also visible right now.
Yes.
Okay. So at the outset, I want to thank the Eizoc team and the members of Eizoc. This is actually my third meeting or my third appearance for this esteemed group. And it's a pleasure to be speaking on such a forum which focuses entirely on ophthalmic research and publications, mainly for the postgraduates and the fellows and the ophthalmology fellows. So it's really an honor to be a part of this program. And today my topic of discussion would be on reference management. And I extended this topic title and decided to make it more simple so that it's easy for all the people who are attending, especially the postgraduates, and understand why is it important and what is important and how we can do a good reference management for both the clinicians and the researchers. So let's proceed further. So with today's goal or the main objective of my talk is to make the concept of reference management logical, reproducible, lucid, and totally stress-free. So don't worry about how do I write my references, how do I gather my references, how do I quote them in my articles, how do I make my thesis, dissertations. Don't worry about it. We'll take care of it in the next 20-25 slides. And I'm going to make it extremely easy, totally interactive. And I want all those 10 postgraduates who have joined this meeting to keep their cameras on and even and unmute themselves, because this is going to be an interactive session and I'll be talking more about it. Let's start with this first slide or this first photograph which we have. This is a small paragraph from one of my articles, and which clearly states that the definitive management of a rhegmatogenous retinal detachment is surgical repair, most commonly performed using pars plana vitrectomy, scleral buckling, and pneumatic retinopexy. And if you see, I have marked something in brackets, which is 1, 2, 3. Now, can anyone tell me what is this? Is this a citation or is this a reference which I am quoting in the text of my manuscript? So is there a difference between citation and reference? So can I have the postgraduates to discuss and tell me what do they think this statement is, and is this a citation or a reference?
It's a reference, sir.
It's a reference, okay. Can you tell me why is this called as a reference and not a citation?
No, sir.
So are there anyone else who can talk about it? Is this a reference or a citation? please please be free to open.
You
And
can open
yeah,
that. Ask my
Sasmita
name.
Mishra has raised her hand. Please go ahead and unmute yourself and you can talk.
Sir, this is a citation because it is included in the main text. And
Ve-
if it would have been a reference, it would have been present at the end of the paper. After.
Very nice, Dr. Sasmita. You have actually nailed it. And you are very right in saying that the thing which I presented in the previous slide was a citation. And there is a basic difference between citation and a reference. So citation is something which we mentioned within the text of our manuscript. It tells the reader where there is a specific statement, idea, or a data which comes from it. We are basically quoting the evidence which has already been already published previously, and it appears inside the text. So this was a citation which I showed you previously, and reference is basically a full bibliography of the work, and it appears in the reference list or the bibliography at the end of the manuscript. So that is the basic difference between a citation and a reference. A reference is not the same as a citation. A citation is not the same as a reference. Now let's understand what is the function of a citation. The citation, it basically supports a claim. It tells you that it links a statement to the evidence which has been put forth by the other authors for the work which they have done. Whereas the main function of a reference is that it allows the readers to go back, locate that particular citation, verify the source, and verify the content which is there within that reference. So when you look at this particular statement, the ones which I have mentioned within the bracket, it's a citation. Whereas when you look at my bibliography, you would see that these three publications which I have included in my citation are basically the references which I have quoted from. There is a relationship between a citation and a reference. That means every citation must have a corresponding reference in the bibliography. So you cannot write a number 1 and not include it in your bibliography at the end of the manuscript. Every reference should be cited at least once in the text. That means every time you have a paper, you have included a reference in your bibliography, once at least within the text, it has to be cited. And if there is a mismatch between the two, the reviewer will definitely raise a red flag and say that you have cited something in the text, but it is not seen in the references. Or sometimes he can say that you have included something in the references, but it's not cited in the main text. There are some common mistakes which can happen. One is that there is a citation which is present, but sometimes the reference is missing. Sometimes the reference is listed, but the citation is not there, or it is never cited. You can have a wrong citation number after the revision and multiple citations which point to the wrong reference. So that's why I wanted to start this talk itself with a basic understanding between a citation and a reference. Now, let me answer this question. Why is this topic important? Because many of us, we keep writing our papers. We feel that if the manuscript is very good, if the manuscript is scientifically very strong, it has to get accepted. But that's not the truth. Now, you will realize that sometimes in my initial years when I was writing, when I was very new to research writing, most of my rejections were actually happening not because of the science which was there, but they were happening because my references or my English language was not up to the mark. So if minor reference errors which we encounter, the reviewers, they notice it immediately because they are professionals. They know that where the references has been correctly cited or where it has been incorrectly cited, they will immediately know that. And reference mistakes, if I make a reference mistake, it clearly says that the work which I am doing, it doesn't look credible, and there is a loss of identity and there is a loss of credibility as well. So for a good manuscript and science, it requires definitely clean referencing. You need to really reference your articles very properly so that it gets accepted in the papers. Now, why do we need references? Now, this is very important. We always need references because there is the concept of attribution. That means you want to acknowledge the work or the idea to the author who has done the work. You basically want to say that whatever I'm quoting in my manuscript is not something which belongs to me, but there is an absolutely opposite end of the same spectrum where whatever you quote, whatever you see in the manuscript which has been written by others, and when you copy that same findings or the same ideas or verbatim the same words, that would account to plagiarism. So the basic in simple words, attribution is something where you are trying as a writer, you are trying to say that this work does not belong to me. And plagiarism is even you are trying to say, even if the work is done by the others, you are trying to say that this work belongs to me. That is what is the difference between an attribution and plagiarism. Now, evidence-based medicine is what it is. In today's day and age, where you have a number of guidelines coming up, you have algorithms coming up, everything based on evidence-based medicine, it is important to include them in your manuscript, cite them in at the right areas, and include them in your references and the bibliography. We need references because it allows us to verify them. It allows us to trace them back and see if there is any mistakes or not. And lastly, references are required because they suggest academic honesty, and that is absolutely important when you are doing a research work or a research writing. So every citation which you include in your manuscript is basically a footprint. Then that footprint is something which you allow the reader to read, to go back and read, and then cross verify what you're writing in your manuscript. Now, why ophthalmologists must cite well? And let me just start with an example. So this is a paragraph which I have taken from one of my publications, or it is a dummy publication which I wanted to just show for our viewers today. So the paragraph reads like this, that the treatment of proliferative diabetic retinopathy in the current era, according to the protocol S of the DRCR NET clinical trial, is anti-VEGF monotherapy. Anti-VEGF monotherapy has several advantages compared to standard pan-retinal photocoagulation. Patients treated with anti-VEGF monotherapy have fewer incidences of vision-impairing diabetic macular edema and visual field loss, and they require lesser instances of performing pars plana vitrectomy for eyes with non-resolving vitreous hemorrhage. So what I'm trying to tell in this paragraph is that anti-VEGF is superior to pan-retinal photocoagulation, and the current treatment of choice in proliferative diabetic retinopathy is anti-VEGF monotherapy and not pan-retinal photocoagulation. Following which, I actually quote this reference and I talk about the classical protocol S of the DRCR NET clinical trial, which compares the pan-retinal photocoagulation with anti-VEGF monotherapy for proliferative diabetic retinopathy. So can someone tell me the statement which I have included in this dummy paragraph, is it right or wrong? Yeah, the postgraduates, please, if anyone knows the protocol S, and do you feel that the statement which I have included, is it right or wrong? Okay, so let's go ahead and let's look at what actually the protocol S spoke about. So this is the reference which I'm talking about, the 5-year outcomes of the protocol S, which compares between pan-retinal photocoagulation versus intravitreal ranibizumab for PDR. It's a randomized clinical trial which was published in the JAMA Ophthalmology 2018. And this is what they actually suggested, that between pan-retinal photocoagulation and anti-VEGF monotherapy, the vision loss, the severe vision loss and serious PDR complications, they are uncommon. So if you look at the clinical trial very carefully, they did not say that anti-VEGF monotherapy is superior to pan-retinal photocoagulation in diabetic retinopathy or proliferative diabetic retinopathy. They said that ranibizumab or anti-VEGF monotherapy is non-inferior. That means it's almost equal to a pan-retinal photocoagulation. But when you give anti-VEGF monotherapy, The complications which you encounter with panretinal photocoagulation are very, very less with the anti-VEGF monotherapy group. So this is where your references must be properly understood so that you can accurately cite them and make meaningful references or inferences in your paper. So a lot of treatment decisions which you take from these references, they will ultimately influence the patient care. The guidelines, the randomized clinical trials, and the meta-analysis, they definitely matter. And if you have a wrong citation, you can have a wrong clinical inference, and that will have a wrong bearing on the patient. So if I have to give an example, the treatment of choice for a patient with proliferative diabetic retinopathy is both anti-VEGF therapy and panretinal photocoagulation, and not anti-VEGF therapy alone. So this is something which if we would have interpreted the reference wrongly, we would have ended up with a wrong clinical inference and a wrong management for that particular patient. Now, let's understand why the accuracy in the citations is absolutely crucial, because this is something which the reviewers will always look at, because the citations which you're quoting in your manuscript, they have to be reproducible. You have to go back. You can you will be including them in multiple areas of your manuscript. It gives the reviewer confidence. If your citations are accurate, then it gives the confidence to the reviewer regarding the credibility of the manuscript and the credibility of the authors itself. It gives rise to ethical publishing, and that is very important in today's day and age. And finally, it gives a visibility to the journal. It gives a visibility for regarding the indexing, the impact factor for the journal, and the visibility of the journal. So in a nutshell, I will say that if you write a wrong year or a wrong journal name, it tells that the reviewer that you did not verify the accuracy of that particular citation, and therefore the reviewer loses confidence in your paper and probably may end up rejecting your manuscript. Now, there are very common citation errors which we do. This is something which I have done in my early days as well. And when you look at those citation errors, I would like to come up with two references here. So the first reference on the left side, it is talking about a group of authors. And if you look at it, it talks about a journal name which is called as Archives of Ophthalmology. And the reference on the right side, it tells you the right group of authors. So if you look at it, the common citation mistakes which we make is that we don't write the author order properly. If you look, the Gross JG and Glassman AR is the right order in which the publication is. And you will realize that in references or in publications, the first author is very, very important, and you should never mix the author order in such situations. Now, a wrong author order is one of the commonest mistakes which we do while citing a manuscript. We can write an incorrect journal name. If you look, Archives of Ophthalmology was an old journal name. The same journal has now been called as JAMA Ophthalmology. You can have incorrect page numbers, you can have incorrect volume numbers, you can have incorrect issue numbers which are there. You can be entering a wrong digital object identifier. The DOI, or the digital object identifier is a very important thing. And the PMID, or what is called as the PubMed identifier, okay, is very important. So if you write a wrong PubMed ID, or if you give a wrong DOI, then the ability for the reviewer to go back and search that particular reference will not be correct. And if you cite retracted papers are something where the journals itself have taken away, either because of plagiarism or multiple reasons where they had to end up retracting the papers. And if you start citing them, that gives a wrong messaging. And this is where these are the common citation errors which we commonly come across. Now, how to cite accurately, and this is where I want to share the 6-point checklist. So every person who's writing a manuscript, they should be having a 6-point checklist. The first very important thing is that correct the final published version. So that is the most important thing. Whatever is the corrections have to be done in the final published version. the author order has to be verified. Like what I said in the previous slide, the first author, the second author, and subsequent authors, the way it has to be accurately mentioned, the journal year, the journal name, the year of the year when it was published, the volume number, and the pages of that particular citation have to be included and mentioned accurately. The DOI, or the digital object identifier, and the PMID should be checked. The citation style, when we talk about the citation style, whether it's the Vancouver style or the Harvard style, has to be correct. And reference matches for the in-text citation. So you should always have whatever citation has been included in text, the reference should be of the same citation which has been included. So once you follow this checklist, so this 6-point checklist, once you follow this properly, you can prevent 90% of your errors during referencing. Now, I spoke about the different styles of citing a reference, and the two common styles of citing a reference is the Vancouver style and the Harvard style. And there is a glaring difference between the two styles of referencing. So let's talk about the Vancouver style. And the Vancouver style is the most commonly used way of citing a reference. So the Vancouver style is basically a numeric referencing. So it can either be an Arabic numericals, but it's a numerical referencing which we use, where we mention the numerics either in the form of a superscript or bracketed numbers. Now this is an example. You would see that in this, the numeric 1 is a superscripted number, and the references are listed in the order they appear in the text. But there are some journals where the references are actually being asked to be listed in the alphabetical order rather than in the order which they appear in the text. Reciting the same paper, you can use the same number, and text appearances, they appear very clean and uncluttered. It is very easy for long papers, and it's commonly used for medical and clinical journals. And for most of your ophthalmology journals, which we work on, this is the most common type of styling a reference. Now, when you compare that with the Harvard style of referencing, the Harvard style basically talks about the author's name, that is the first author's name, and the year or the date of referencing. It also talks, so the way you write the Harvard style referencing is basically you write the surname of the author and then the year in which the paper was published. So if you look at this example, Brown, then you put a comma and then the year in which it was published. Usually the reference listing order is in the form of alphabets. It is in an alphabetical order. The reciting is done where you'll again have to repeat the author's name and the year of reference. It's very text heavy, it's bulky, and it's basically used for social sciences and humanity journals. And in ophthalmology, the Harvard styling is very rarely used. There was one particular journal which I remember, the Nepal Journal of Ophthalmology, which actually asked us to do the styling for the references in the Harvard style. Whereas the other manuscripts or the other manuscripts which I have written for different other journals, they usually prefer the Vancouver style of referencing. Now, we know that we can do referencing even manually. That means you identify the journal, then you start writing the author's names, then you write the journal, the title of the manuscript, you can write the journal name, the year in which it was published, the volume in which it was published, the issue number, and then the pages. So you can do all this manually as well. But when is it acceptable? So manual referencing, I have done manual referencing way back, almost 6 to 7 years back, when I was writing my initial case reports or publications. But manual referencing is practically impossible when you are writing large articles like systematic reviews, meta-analysis. It is practically impossible to do manual referencing where the same reference is being cited at multiple places within the manuscript itself. So manual referencing is good enough for short articles where the number of references are less than 50, especially in situations like case reports or case series. It can be useful for editorials and commentaries where the number of references are very low, and letter to the editors as well. Now, manual referencing doesn't mean that you are inaccurately citing those references. It is not similar to the word inaccurate, but it's basically more time consuming. And that is the problem when you do a manual referencing. Now, automated referencing, why is it is superior to manual referencing? Why is it winning all the time? Because automated references has a higher speed. You can do the referencing very, very fast. The style flexibility, which we talk about for different styles, like where you want to convert a Vancouver to a Harvard or a Harvard to a Vancouver style, you can do it immediately in a matter of a few seconds. The consistency for the automated referencing is uniform. You don't have to worry whether I have written 3 authors and et al. Or 6 authors and et al. The minute you choose the automated referencing, it will identify or it will adjust itself to the journal guidelines, and then make it uniform for all the 30, 40, 50 or 100 or 500 references which you have included in your manuscript. It makes your revisions very, very easy. So that is why automated referencing is very important. And for larger projects, especially for systematic reviews, meta-analysis, narrative reviews, where your number of references, they go up to about 130 to 150, it is very, very useful. So automation is basically efficiency. It increases your efficiency. You don't waste a lot of hours or days in just adjusting your references. Now, which articles, like I said, which articles make referencing an headache? And you would realize that it is the systematic reviews and meta-analysis which have more than 100 plus references. That is a big headache for us. Narrative reviews, like I said, thesis or dissertations for all the postgraduates who are going to be writing thesis or their dissertations. Using an automated way of referencing is an absolute must. Multi-author consensus paper, where you have a white paper or multi-consensus guidelines being given by different groups. In those cases, referencing is a headache. And when you are doing multiple resubmissions, journal resubmissions, especially when your first journal has rejected your paper and then you are wishing or intending to submit it to an alternative journal, where you have to follow the rules and regulations or the authorship guidelines of that particular journal, then referencing an article manually becomes a very big headache. So these are impossible to manage. All these 5 points which I just spoke about, they are impossible to be managed manually. Now let's talk about the reference management software. And this is where I'm sure all of you all are going to be super excited to know which are the reference management softwares which are currently available. And please take a note of all these softwares which I'm going to talk about. The first and the most important thing is Zotero. Zotero is one software which is freely available, accessible. It is available both for Androids as well as for Macs, and it is a freely available software. The second one is Mendeley. Mendeley is an all-in-one reference manager, which is again a freely available software. And EndNote is not a freely available software. It's a paid version, but you can have EndNote free, which is where only limited applications they can be utilized with EndNote. So the choice of the software which you have, it matters less. And more importantly, what matters the most is whether you know to use these softwares properly or not. So again, just want to summarize the slide saying that you have the free softwares, reference softwares, which is one is Zotero and Mendeley, and the paid version of EndNote, which is most commonly used for your reference management. Now let's talk about the free software, and the free software which we commonly use, or which I commonly use as of date, is Zotero. And Zotero is a free software. Mendeley is again a free software, and EndNote with limited features is freely available, but it's basically a paid version. So what I recommend for all the residents and the postgraduates, the fellows, and even young researchers or young faculty people is Zotero. Zotero is one software which is an excellent tool, which has made my life very simple, and it's made my referencing very, very simple and accurate as well. Now let's understand why clinicians love Zotero. And Zotero is something which is a free and an open access or an open source software. Now I will show you something which is the second important point, and I will show this in the form of a small video presentation where it has got a browser connector. So in Windows 11, we commonly use Microsoft Edge as the browser. And when you have plugins which are available with Zotero, it directly syncs with your browser. So I'll just show you a small video. So this is a video, you can see this. This is the main page of Zotero, where I've just created a small collection within my library, and I've just labeled it as Orpi 16 December 2025. Now, this is the article which I want to include in my Zotero thing. And you would realize that within the software itself, because of the Zotero plugin which I have, it directly makes it easy for this software, for this particular article to be included in my journal, in my Zotero library. And you would see this, that this is the article which we published. Both Chaitra and me were a part of this publication. There are other ways of including this publication into the Zotero library. And the other way is to write the PMID number or the PubMed index number. And that will also help you to include this publication directly into your library. The third way is to use the copy and paste your digital object identifier, that is the DOI. And once the DOI is copied, you can include that into your directly into your Zotero item. And once that is being done, it will show you that it is a part of your library. The other way is go and add this item into the identifier, and that will help to include your manuscript or your reference into the Zotero library. So this is where I'm using the DOI identifier and including it into my Zotero library. And you would see that these are the three ways by which a publication or a reference can be directly incorporated into your reference management software. So let's go to the second big advantage of Zotero. The second big advantage of Zotero is word integration. And we write most of our manuscripts in Microsoft Word. And this is a very small example which I want to show. So if you look at this particular Word document, so there is a Zotero plugin which is present already in the top toolbar. And when I add a citation, when I want to add a particular citation to a statement, then what I do is I just write the name of the author or the name of the journal article itself, and that will help in including it directly into cited in my text, and that can also be directly included into my references or the bibliography. So here you can see that I'm including Gandhi et al., and Gandhi et al. Is now included. And secondly, what is happening? I can shift my references based on the journal requirements and where I'm placing it. So the reference numbering will also change automatically depending on the position where I place it in the manuscript. So the last way is easy way of creating a bibliography. And this is very important because whatever references you have cited in your Word document, you want to create a bibliography at the end of your manuscript. And this is a very good way Zotero helps us, that this is the manuscript, this is the citations which I've included. I just need to go add a word of reference in the next line. And once the word references are included, I just need to go and add bibliography or edit my bibliography. And you will realize that all the 4 references which have been cited in the paragraph are now a part of the references. Now, even with the references, I can change it depending on the journal which I want to reference it accordingly. And I can use it for a survey of ophthalmology or any journal which is there. I can include it and I can use it very easily, very fast, and very accurately as well. So this is the big advantage of Zotero. So the Zotero has got the best balance of power and simplicity. And that is why this makes it as my go-to reference management software for all my publications. So which one should I choose? There is always this one of between Zotero and EndNote. I know Chaitra uses EndNote for most of her articles, but I use Zotero because it's free and open source software. It's best for postgraduates and fellows. There is an iClick PubMed import, which is there, which I showed you in my previous video. You can collaborate your library with multiple people simultaneously. It's got a very easy and a very lucid learning curve. The plugins and the community support is excellent. And when you're working on small or medium-sized libraries, that means for references which are less than 150, I think Zotero is a very simple tool, and that is very useful. While on the other hand, EndNote it's a paid software which is mainly for institutional use and not for individual users. It is commonly used by senior researchers. It's got an advanced referencing control. It has a strong deduplication concept where unnecessary duplication of the references is removed. It is very useful for large libraries where your number of references are 500 and beyond. And it has got this concept of cite while you write. That means while you're writing a particular statement in your manuscript, you can cite it then and there itself, and that can be very useful. So I don't know which software to choose, but for the kind of work which we do in ophthalmology, I think Zotero still holds the best. It's the best software. But more than that, I would just suggest that it depends totally on the workload which you are doing, and don't choose a particular management software only on the basis of its popularity or the cost which it includes. So the last part of my talk is going to be on team workflow, which is the most important hidden secret which I'm going to share with you. I always allot one person who's called him as my reference captain. And when I say reference captain, he's the one who's going to look into my references, see whether the references are relevant or not, whether the references which have been included in the bibliography have been accurately cited in the text as well. The references which are cited in the text, do they have a proper quote within the bibliography or not? So I have one per person for all my manuscripts who's going to take care only of my references. There is one reference master file which we work on. We lock the references before doing the final formatting of those references. And this slide alone will save you weeks of confusion, because the references beyond 50 references within your manuscript, it's very difficult to handle. And therefore, when you have a person who's dedicated and working only on the references for your manuscript, it's really, it's a blessing, it's a boon for all of us, and it saves a lot of confusion which can happen. So so final reference quality check is something which I always do before I submission. So the reference captain, he will check for the alphabetical scans, the missing years or pages which we have. If there are any DOIs which are not properly entered, or if they are not properly written, then we'll have to check for that. We'll include duplicate trials. We'll have to check for duplicate trials, duplicate references, and always see for the in-text versus the reference list mismatch. And this is very important. So do this once and avoid a reviewer embarrassment. So this is a lot of times the reviewer actually comments and says the reference number 40, which you have included in the manuscript, is not cited in the text. And same way, the reference number 40, which is cited in the text, is not included in your bibliography. And that is a very embarrassing moment as an author. So there are some few take-home messages which I want to say with at the end of this presentation. References are evidence. They are not used for decoration of your manuscripts. Please understand that. This is very clear-cut references or ideas or thoughts which have been accepted by or promoted by different authors. They are not for your decoration, just to include them in your manuscript and make it more looking better. Automation is necessary these days and not a luxury. You will realize that with the help of automation, your referencing becomes very fast and accurate. Accuracy is very important and is equivalent to credibility. The minute you give good, accurate references and relevant references, that improves the credibility of the article which you have written, and it improves the credibility of you as an author. Zotero is for the beginners, whereas EndNote is for power users who are working on large-scale articles or large-scale manuscripts. And always verify your key papers. When you have articles which are going to give you guidelines, consensus articles, meta-analysis, systemic reviews, always verify the references which have been included, and always verify them accurately and appropriately in your manuscript. So to conclude, I would just say that good references, referencing reflects good thinking, and that is what is extremely important in today's day and age when you're writing a paper. Thank you very much.
Thank you so much, Dr. Venkatesh, for such an elaborative and informative talk. I'm sure our residents have benefited a lot, but I would like first our panelists to have their comments. I'd like to start with Dr. Chandana Chakraborty, ma'am, if she's here. Madam. Professor Dr.
This is
Sunil
just
Kumar,
an
sir.
excellent talk, I must say. Excellent talk.
Thank you, ma'am.
Many things have become clear to me also, actually. So we are the means our times, all this computer and these things were not there that time when we started our job. That time it was more difficult actually. But I feel that the newer generation, they are good takes it and they will learn it very fast. That is the most important. Thesis writing is the. Hello, I'm audible.
Yes, ma'am.
Hello.
Yes,
Hello?
ma'am, you're audible.
You're audible, madam.
The thesis writing is the first step of how to write the reference. That is the first step of our postgraduate students, because article writing comes next to that. If then during the thesis writing, they know all this nitty-gritty of how to write this referencing, that will help them in the future writing also. So that is very important. What I feel is that this is the most neglected part, what we feel during writing an article, because the author or the group of authors, they become exhausted at the end of writing an article, be it a case report, be it an original article. They become exhausted. They feel that this is now it's a very nice looking, everything is fine, this is going to be accepted. And invariably, what I'm seeing when I'm asking my juniors to learn this thing, invariably the thing is most of the at least 50% of the articles are referred back within 1 week, just because of the wrong reference writing, I must say. So this is the part which actually we have to make them very we should make them understand that, see, this part you cannot neglect. Every punctuation, what I see is that the punctuations in the referencing style is very, very important. That should be taken care of. Every colon, semicolon, comma, all these are very important. So if they write it, they know it during their thesis writing phase properly, I think they can do it better in future also during their article writing and submission. That's all. Thank you for giving me the opportunity to talk.
Thank you, ma'am. Thank you, ma'am, for highlighting some important aspects of thesis writing. And I would like to take a comment from Dr. Sunil Kumar, sir, from RIMS Ranchi.
Yeah, good evening, ma'am. Excellent presentation by Dr. Ramesh. I think all residents must have benefited. And as Madam said, that references are the most neglected part. Even when we check the thesis, most of the time the references are not checked by the guides. But when I check, there's so many mistakes are made in the references pointed. Many times I say they just write one name of the author, then it all. They do not understand. So exact reference management is very, very important. And all residents must know how to reference them. Very. And sometimes we also know how to reference the book. It is just about the journal, not journal, but sometimes they quote the book. So how to quote the book chapters and how to write that is also very important.
Thank you, sir. Thank you, sir. I would like to ask Dr. Venkatesh whether if you are, now that one is using AI to manage your references, are the reviewers using AI to check the references which are being submitted?
Uh, for writing my references, I still don't use the AI. I don't use the AI. I work on the references. I identify which references are relevant for my paper, and then I use Zotero to include them in the manuscript. But you may be right in saying that nowadays the editors or the assistant editors and even the reviewers, they may be actually checking the manuscripts and putting it on ChatGPT and seeing whether these references which have been included, are they relevant and whether they are accurately placed. So that can still happen. But for the writing and including, I have not used the AI. But sometimes if I really want to check whether the reference is accurate or not, I may probably use AI and then again cross verify it with PubMed. So that is something which I do.
And can you just give a small tip to the residents as to how recent should be the inclusions, how old and how far back you can go, you should go when you are putting in references?
So ma'am, it depends on the content which you're writing in the manuscript. Okay, so if you're talking about a principle which has been which has been included, let's say that the principle of RD surgery suggested by Dr. Jules Gonin is XYZ. So in that, you will have to go back way back when Gonin actually suggested what would be the principles of RD surgery. So that is must. But when you're talking about guidelines, when you're talking about recent innovations or recent papers, they should be as recent as possible. So especially for narrative reviews, when you're writing, you should include the papers which have been recently published on that particular topic.
Thank you. Thank you. Can I take a comment from Dr. Sachila Bhoi from, I can see her on the screen. Ma'am?
Good evening, ma'am. Good evening, all. So, our college is a new college in Odisha, and today's session is very, very, very informative for our students. They are yet to write a paper, so it is very useful and it will be very, very beneficial to our students to write a paper.
Okay, thank you, ma'am. Thank you. And I would like to move to the, if I'm missing any faculty because I do not see Dr. Ruma Das, ma'am, Dr. Sharmishta.
Ranjana, can I make a comment, please?
Yeah.
Ramesh, I don't know if you touched upon this, but there's also when you're putting in your reference list, there's also small area of self-citation of your own papers. So is there a limit on the number of what is a good practice? Because certain journals actually tell you that you cannot cite too many of your own papers. And of course, citing your own papers does add up to your the different scores. So is there a limit, and how do you determine that?
So there is no particular limit regarding the citations of your own paper. So there are a lot of papers on MacTel which I've written, a lot of papers where I end up citing my own papers, but there's no limit. But sometimes the reviewers can actually say that don't cite your own papers. That can happen to you. But when it comes to the scoring which you spoke about, probably the ResearchGate score or your H-index score which you speak about, you will always see that in ResearchGate there is a score where there are two scores which are available. One is your true H-index score, and one where the H-index score is without your citations as well. So when you're citing more of your own, your H-index score may be slightly higher. But when you exclude your self-citations, you will realize your H-index score is lower than what it is. So it's not a good thing to keep citing your own papers because it doesn't add much value to the entire thing, because people will look at your H-index without your self-citations.
Thank you.
Yeah, thanks. A superb talk, Ramesh. And one more small tip that I had learned is, in case you do get to know, who the editor of that particular section is. Apparently, they're very happy when their papers are cited. So no, it apparently makes a lot of difference. And reviewers, of course, we don't get to know. Most of the time, it's blinded. But you can suggest potential reviewers. Like suppose now I'm writing a MacTel paper, I will give Ramesh his name because he does a lot of work on MacTel, and automatically I'll be citing his papers. So this helps because they are very hostile to Indian publishers. They're very, very hostile. So even though we have done a very good job of writing the paper, they always have negative comments. The very fact that it's come from India, that it's not well written. Language wise, they suggest language written. So these small things can help in a long way.
Thank you. Thank you so much. Do we have Dr. Sucheta Pareja and Dr. Sujata Priyamvada with us? I hope I'm not missing any of the panelists. I would like to move to the discussants and ask them if they have any questions they can put forward. This is a one in a lifetime opportunity to just.
Ranjana, I just want to add a few more
Yes, ma'am.
points. One thing is that when the juniors they start writing the thing, they don't know actually which one needs referencing. That is important. They have to learn the which means line needs referencing. Sometimes they will write 3-4 lines which are coming from the different reference, but they are not, all the things are not put in there. Or sometimes suppose you are giving a formula or an Eizoc technique, all these things needs referencing. So these are the things they should learn. These things need reference. That is very important. No, you cannot, in the conclusion, there should not be any referencing. They should know this. In the abstract part, there should not be any reference. These are just small things. Means this is not related to reference writing style, but where to put the reference. Only the introduction part and the discussion part needs reference or citation, but sometimes you may put it in a materials or method. Sometimes you can put a reference also if you are introducing something, some formulas, age-old technique like this. That also needs reference. Am I clear?
Thank you, ma'am. If any of our discussants would like to put forward a question, are there any questions?
Good evening, ma'am.
Yeah.
Myself, Dr. Asmita from NMCH Patna. Ma'am, I would like to ask that is there any optimal number of references to be added? Like the number of references which we add in a review article or suppose in a poster or a paper presentation. So what should be the number we should add, which could give your article a more good review while accepting?
Dr. Venkatesh, would you like to take this question?
So, if you remember my take-home message,
Yes, sir.
the slide said that references are evidence, then they are not for decoration. So you have to include the references which are relevant. The numbers, the minimum number of references which you can include, there is no number to that, okay? But you cannot exceed a particular number of references which the journal allows you. So there can be review articles where the journal will say that not more than 100 references can be included. Or you have an original article where it will say that not more than 40 references can be included. Or if you have a case report which you're writing, not more than 10 references. So you can go to 5, 6, whatever is relevant for your particular article, or 30, 40. But you cannot exceed beyond what the journal guidelines are. So that is something which you have to follow. So it's not about writing, including optimal number of references. I would use the word including relevant number of references, which are useful for your manuscript and making your point in the manuscript.
Thank you so much, sir. Thank you.
Anybody else would like to post a question? Dr. Chaitra and Dr. Ramesh, both of you have been reviewers for IJ also, I think. Which is the commonest error that you've encountered among the PGs or residents or the papers which are submitted, or which you can say that, okay, it's a novice thing and needs so many rewrites? Is there some common error which is being made?
So we don't know who is writing the paper because it's blinded, to be very frank. But sometimes what I feel is that when we write the when I review a paper, I look at how strong the methodology of the paper is. So that is what I try to look at. First is where I will only focus on the inclusion criteria, exclusion criteria, the statistics, the results, etc., whether they are relevant or not. Once I find that they are good and they are the way the study has been conducted is right, then only I will go back one page to the introduction, and then in the later part to the discussions. Now, what's important, which I will try and say, is that the introductions are very poorly written in most of the IGO articles. You really don't understand that we don't, in comparison to the Western people, we don't know how to write good introductions, because introduction is one thing where you have to be really crisp about why you are doing this study, what is the benefit of doing the study, and what were the previous publications, were there any previous publications related to the topic, and what were they trying to infer from those papers. That data has to be crisp, it has to be really short, because the reviewer doesn't have the entire time to read almost 2-3 pages of introduction being written. And this is something where I am a victim of, means I do the same mistake sometimes previously, but we don't write crisp introductions, and that is something the reviewer keeps commenting and says that your introduction is not relevant, and you need to cut short on your introduction, and you need to include some important relevant references, the latest references as well.
I have seen introductions where every line is referenced.
Yeah,
There is not
exactly.
a single original. Is that a good way to start an article?
Not a good way to start an article at all. Yeah, but there will be, you should really know where to start your introduction itself from. You don't see, if you are looking at the outcomes of bacillary layer detachment in rhegmatogenous retinal detachment, I cannot start the introduction saying that what is a rhegmatogenous retinal detachment. The reviewer is not interested in that. Basically the reviewer is interested in knowing, okay, what is bacillary layer detachment? Okay, has it been mentioned in other clinical diseases as well? Has it been reported in RRD cases? If it has been reported in RRD cases, what are the outcomes which they have reported? What kind of outcomes are you looking for from your study? And that is why you want to do this study. That's it. That is the simplest thing which the reviewer wants to look at in this. But what we do is we start right from the beginning. We start from RRD, types of detachment, break, this, that, etc., etc. And by the time it becomes so lengthy that the reviewer gets totally bored and says, "Arey, he doesn't have a flow of thought at all. The author doesn't have flow of thoughts."
Subudhi sir?
Dr. Ranjana, just
Yeah.
to add on the first question that you asked, what is the most, so there is something called as technical modification. So when I used to work for IGO, we complete the technical modification before the paper send out for review. So most often the reviewers don't get to see what are the deficits. One of the main deficits was in quoting of references. Either they were not quoted or cited, like how Ramesh said in the beginning, what is the difference between citing and the reference, they're not cited properly. Like IGO has a particular way in which the reference numbers need to be cited, or how the references, like in IGO, we follow 6 authors followed by et al. Most of the times it's 3 followed by et al, or some of them have Vancouver style. So most often, I would say at least 70 to 80% of the time, the major or the bulk of the error was in quoting references, which is why in the beginning I said that this is a very, very important topic. And at that point of time, we don't really look at the science, whether it's an original article or a case report. A technical modification that goes to the associate editor or the section editor, and then to the reviewers. So technically the biggest problem is almost always with citing and quoting the references.
Thank you so much. Thank you so much. Subudhi sir, would you like to make a comment?
If all the talks, all the discussions over, then I will put a comment and I will end this session.
Dr. Das, Dr. Devashish Das sir, can
You are muted.
Sir, please unmute yourself.
God. Sorry. So it was an excellent session, and this is a topic which was never been covered in our webinars earlier. So thanks to Chaitra for taking this up. Number one. Number two is, say, during our post-graduation days, we
never had the scope of these reference management systems. We were never aware of it. Now that these are in vogue and will come in very much in circulation, I think today's the postgraduates are very lucky to have these sessions, and best of luck to them. Thank you.
Thank you so much, sir. Thank you. Sir, a comment?
I think I will give the comment and then Dr. Santosh, are you there? I think he's left. I think Dr. Santosh left. Anyhow, it's a really wonderful discussion. And as Dr. Das said, this topic is a very interesting topic. I have discussed in the past this topic, but every time we get new postgraduate students, so again, we repeat some of the topics for the benefit of the new students. So really, it's a wonderful talk by Dr. Ramesh, and he made this talk very simple and understanding way. And I think our postgraduate students, they must have learned a lot today. Why postgraduate students? Some of us also learned this reference management, how to do it. So thank you, Dr. Ramesh, coming with us and making some of the topics very simple. Last time also we had a very simple talk by you, and this time also in future again you will be with us, some other topic discussing with us. So thank you, and thank you, Dr. Anjana. Really nice moderation, and you have involved everybody in this webinar, both panelists and students. Thank you very much. And Dr. Sachala is there. I think Madam, Dr. Chandana Madam, and Dr. Sunil Kumar have contributed a lot for this talk. And some of the postgraduate students still they're silent. Of course, with this a new topic, many times they are beginners. They become shy to ask questions, and sometimes they have not yet understood the how to write an article. So that is our attempt. Basically, it's a residence program to write articles. That's the basic objective of these programs. So I think we'll proceed similar way every month or every month twice these topics. So thank you everybody, and thanks last but not the least our mentor Dr. Chaitra and our Eizoc team supporting me for these programs. Thank you all. And last but not the least is our platform supporter, Enter Pharmaceuticals. Thank you for supporting these programs. Thank you all. Good night. See you again next fortnight.
Thank you.
Thank you, sir.
Thank you, everyone.
To write well, let us all read well first.
Yeah. Yes. Good night.